Hey everyone, good morning. Welcome to our webinar today. My name is Nadir Narayan. I'm Senior Program Director at the Interfaith Center on Corporate Responsibility, a coalition of faith and values-based investors representing $500 billion in assets under management. Using the power of shareholder leverage to facilitate corporate change on human rights, health equity, the climate crisis, food justice, water stewardship, and other issues. In the past 4 years, investors have ramped up decades-long efforts to address the crisis of antibiotic resistance. Antibiotic-resistant superbugs are created by the overuse of antibiotics. According to recent estimates, antibiotic-resistant bacteria could kill more people than cancer worldwide by the year 2050. One of the main causes of superbugs is the overuse of antibiotics in food animals. These drugs are often given to healthy animals to prevent illness caused by unhealthy conditions on commercial feedlots, rather than to treat illness. However, best practice, such as improved sanitation, vaccination, and nutrition, can reduce the need for antibiotics. The industry's slow response to this problem poses serious health and business risks. Our webinar today is focused on learning about two important tools investors can use in engaging companies to reduce antibiotic use. We are joined by our allies in this work, Lena Brooke and David Wallinga of the Natural Resources Defense Council, or NRDC, and Laura Rogers of the George Washington University School of Public Health to discuss the latest Chain Reaction 4 report on how top restaurants rate on reducing antibiotic use in their beef supply chain. We've had the pleasure of our allies being on similar webinars to discuss the previous Chain Reaction reports. We'll also learn about how we can engage companies on the Certified Responsible Antibiotic Use standard, the first responsible use standard certified by the USDA that allows for minimal use of medically important antibiotics. Before I turn things over to our speakers, a few logistics. Your lines have been muted. We encourage you to ask questions along the way, so please type them into the question or the chat box, and we'll pause periodically to address them. Lastly, this issue of overuse of antibiotics in the meat sector is not only cause for a medical crisis that we must avoid, it's really an opportunity to reform the meat production in America. It's up to investors to make sure that companies respond appropriately. With that, I'll turn things over to Lena to get us started. Thanks to our speakers.
Great, thank you so much, Nadira, for that excellent introduction. As was said earlier, my name is Lena Brooke. I'm the Director of Food Campaigns at the NRDC based out of our San Francisco office. And both David and I work with our health and food team. And David will introduce himself in more detail a little bit later in his section of the presentation. So I think with that, we can turn to the next slide, please. As some of you might be aware, NRDC and our allies in the Antibiotics Off the Menu Coalition, and you see the logos of the collaborators here on the slide, have been releasing a scorecard called Chain Reaction, actually for about 4 years now, since the fall of 2015. And Chain Reaction evaluates how top restaurant chains in the United States rate when it comes to the antibiotic use policies and practices behind the meat and poultry that they sell in their restaurant locations. And in October, actually on Halloween this year, we released the 5th edition of that report. Next slide, please. But before I get into the details of what we have found in this year's Chain Reaction, I want to just kind of level set a little bit, not knowing exactly who's on the webinar, and build a little bit on the introduction that Nadira had provided about what antibiotic resistance is and why it's a huge problem. And the statistics that you'll see on this slide kind of give a sense of the impact on how many people get sick or die from antibiotic-resistant infections, and also a sense of the economic cost to our society. And these are all fairly likely to be conservative estimates. The World Health Organization, the CDC, dozens of public health and medical groups have identified antibiotic resistance as a top global health threat. And we know that this critical part of our medical toolkit is slowly starting to fail because of both misuse and overuse. And just for me, like one of the most sobering statistics that I've heard recently, and this is related to some new estimates that CDC had released recently, which do remain quite conservative, but if you can contextualize their numbers a little bit, they suggest that someone in the United States gets an antibiotic-resistant infection every 11 seconds, and every 15 minutes someone dies. So those are sobering statistics, and a big reason of why NRDC has been working for about a decade now to rein in this overuse and get a handle on the health threat. Next slide, please. While we understand that antibiotic overuse is a big problem in both human medicine and in animal agriculture, our collective advocacy has focused on the livestock sector because really that is where the bulk of the consumption lies. This slide shows that, and this is based on the latest data that FDA had released on antibiotic sales about a week ago. About 2/3 of medically important antibiotics that are sold for use in the United States are going for food animals as opposed to for human medicine. So our advocacy is focused there because that seems to be where the biggest bulk of the problem lies. And as Nadira had said earlier, and I think it's worth stating again, like the vast majority of these drugs are given to animals that are not sick through feed and water on a regular basis with the intention of helping them survive what are crowded, stressful, unsanitary conditions on factory farms where most of our food animals are raised. So we believe that we can do better with these precious medicines. Next slide. Oh, let's go back one more. Thank you. So breaking down the livestock sector and the sales patterns a little bit more, this slide shows how medically important drugs that are sold for use are kind of divided by different major livestock sectors. And again, this is based on the data that the FDA released, the antibiotic sales data last week. And what we see here is that most of the medically important drugs that are being sold at this point for livestock use are going to cows and to pigs, so over 80%, whereas you see a much smaller number, 4%, for chicken. And there's a lot more to this story about the data that were released last week by the FDA that David is going to fill everyone in on. But I just want later in the talk, but I just want to ask that folks kind of hold this pie chart in their heads, and particularly that red section that has a cow in it, because that will come up again in a few minutes. Next slide. So from an advocacy standpoint, our goal with the chain reaction scorecard and with our market-facing campaigns more broadly is to create a race to the top in the restaurant industry. So through the scorecard, we've been successfully able to identify leading companies as well as put laggards on notice. And that, of course, generates a lot of attention in the media, consumer interest rises, and that combination of our advocacy and the investor efforts that ICCR and allied groups are working on really forces decision makers and C-suite in particular to pay attention to this issue. And then that creates sort of this virtuous feedback loop where more and more companies commit to responsible use and the whole thing starts over again. And we've had a fair amount of success with this in the last few years, and the chain reaction scorecard has been an important part of it. Next slide. So as I mentioned earlier, we started this project in 2015, and this was also the first time that NRDC and members of the Antibiotic Off the Menu Coalition had started campaigning against restaurant chains, where we were calling on individual companies to set strong corporate antibiotics policies, in addition to this kind of call to action to the industry more broadly. And from the get-go, we were, and we continue to do this, we're really looking at 3 different categories that we're evaluating companies against. One is policy. So we want companies to set meaningful time-bound policies that only allow for antibiotics to be used in times when animals are sick and not on a routine basis, as is currently the practice oftentimes. We're looking at implementation. So we want to make sure that these are not empty promises that the companies are making, but that there is continuous improvement and that they're abiding by the timeframes that were made initially. And we're also looking at transparency. In particular, we want, because these are, of course, voluntary commitments, we want companies to be working with trusted third-party verifiers to ensure that that the pledges that they're making on a corporate level are actually reflected on the ground on farms. We also want them to be communicating honestly and frequently with the public about their progress. And also, we also like to see that they engage in this project. So keeping those 3 different categories in mind, we evaluated the top 25 restaurant chains back in 2015. And as you see in this scorecard, the industry was not doing well on this issue. Most companies were failing. We had, of course, a few leaders in the A category and a couple of other companies that were landing somewhere in the middle. But overall, there was a lot of work to do and not a whole lot of progress being made. Next slide, please. So when you fast forward 5 scorecards later to the fall of 2019, I'm really happy to report that the story looks very different. We were able to double the number of companies getting A's on our scorecard. There are far fewer failing companies and a lot more grade differentiation in the middle. And this is a really impressive shift that has come about in just a few years. And I will just say this again and again, it has been, I think, in large part due to the kind of parallel efforts and collaborative efforts between the advocacy groups in the Antibiotics Off the Menu Coalition and all of the work that's happening on the investor side that's sending a really clear and consistent message to these companies that inaction isn't really an option anymore. Okay, next slide. So taking another kind of glance from a different perspective on the progress that's been made over the last few years, when we started, we had 5 companies with passing grades. We almost doubled that from the first to the second year. And now the last couple of years, we have 17 companies that have passing grades. And that's 17 out of 25, which is good. It shows a lot of change. Next slide. And I'm hesitant to say however, but I will say however, the vast majority of this positive progress that we've seen in company grades on the chain reaction scorecard really has been because of commitments that companies are making to end routine antibiotic use in chicken. And while of course we're really looking to see across the board commitments, like that's our long-term goal is and we know we're not going to be able to solve the antibiotic resistance threat by focusing on one sector alone. We all have a lot to be proud of for the change that we've been able to create in the chicken sector that really has in large part been sparked by our collective advocacy. So according to the information that we've seen at NRDC, back in 2010, at least when our organization started working on this campaign in earnest, there wasn't one major chicken producer that had publicly committed to end routine antibiotic use. And according to data that came out earlier this year, industry data, as of 2018, over 90% of chicken produced in the US is done so without drugs that are deemed medically important by the FDA. So that's a really impressive transition. It's a change that, or at least like the fact that the chicken industry does not buy a lot of medically important drugs is reflected by those FDA data that I was mentioning a few slides ago. And in fact, the chicken industry, when the FDA first started releasing species level sales data a few years ago, I think the chicken industry started at 6%, and then last year it was at 5%, and this year it's at 4%. So there has been a continued decrease in that sector, and now they really represent a tiny fraction of overall livestock sales. So this work is really important, this marketplace work that we're engaging in together, of course, because as we all know, despite decades of public pressure and the clear threat to public health, the federal government continues to fail on this issue. They've not been able to set comprehensive policy that addresses antibiotic overuse, and legislation has been stalled in Congress for more than a decade, despite bills being available for the taking. Should anyone be interested in taking this seriously. So I think we can turn to the next slide. With all of that progress in chicken in mind, the chain reaction, that organizations that are working on chain reaction about a year ago decided that we really wanted to turn our attention and shine the spotlight a little bit more on beef specifically, frankly, to create a similar ripple effect that we were able to make in chicken in the beef sector. And if you recall on that pie chart that I showed at the beginning, again, over 40% of medically important drugs that are sold for use in food animals are going to cows. So that seems to be the sector where we need the most reform, although pork is nipping at their heels. So really the change needs to happen in both places. But because restaurant chains are such big buyers of beef, and especially the large burger chains, we think that they have a particular responsibility and hopefully also power to exert influence on beef producers to change their practices. So this is, in 2019, we actually had 2 scorecards in our report. We had the one I showed you earlier that rates companies on their overall meat and poultry supply chain, but then the one we really featured and focused on publicly is this beef scorecard, where we honed in on those same 3 categories: policy, implementation, and transparency, but specific to the beef supply chains of the top 25 restaurants. And what you see here is actually a scorecard that looks very similar to our first 2015 version. So lots of failing companies who are not taking action on beef at all, a couple of our familiar leaders in the A range, and a few companies that are in the middle here. And what this says is that the beef industry, as we probably can collectively appreciate, is really far behind on this issue, and to some extent digging in their heels, which is even more concerning. And what really disappoints me is that major producers like Tyson, for example, who were very early on leaders on ending routine antibiotic use in their chicken supplies, are silent on beef. So the same company taking action in one sector, not taking action in another. This is really a problem that we need to fix. Next slide, please. Really quickly, I want to highlight that although there's a lot of work to be done on beef, we are starting to see the beginnings of change. Thanks in large part to Sister Susan Micka and ICCR's tireless advocacy with McDonald's in the last few years. That company did come out with a policy about a year ago that committed them to ending routine use of medically important antibiotics in their global beef supplies in the future. And it was a policy that overall the advocacy community felt cautiously optimistic about. Although right now there's still a lot of details that need to be brought forward before we can really understand the impact and what the company is really promising to do. They are piloting this in 10 markets right now. They're promising to release reduction targets in the next year. But our biggest concern really is that we don't really have a sense as to how ambitious they're going to be at this point, and their policy does not come with any promise of third-party verification, that assurance that we really need to make sure that this is substantive and not greenwashing. McDonald's got a C in this year's chain reaction, up from an F last year, which earned them the biggest mover award. We had some superlatives that we played with for some fun, and we're in communication with them to make sure that that they know that we're watching really closely. Next slide. So as the slide header says, what we're also seeing right now with beef is that the policies that companies are making are all over the map. So with chicken, they usually came in 3 different categories. It could be raised without antibiotics, it could be raised without medically important antibiotics, or maybe a policy that says no routine use. But for the most part, they were really consistent across the restaurant sector. Right now with beef, it's kind of the Wild West, and that is also making it difficult to understand where companies are coming from, how substantive their policies are, and what the impact, frankly, will be. So you heard a little bit about McDonald's. Taco Bell came out with their policy this July, and what they said is that they would cut medically important drugs by 25% by 2025 and issue a progress report in 2022. So we weren't super happy about that. They got a D for effort in chain reaction. We felt that this was a really long time frame for a very modest reduction, and there's a consistent concern that the beef industry is focusing mostly on cutting one drug, which is tylosin, as opposed to really thinking about in a comprehensive way how to transition their operations to be much more sustainable and much less reliant on routine antibiotics use. So we'll see what happens with Taco Bell. Next slide. And finally, I'll just also mention the other kind of elephant in the room here, which is Wendy's. They are also engaged on action when it comes to antibiotic use in their beef supplies. They came out with their latest approach, as I like to call it. I don't like to call it a policy because it really isn't strong enough or comprehensive enough to be described by that word. They were sort of nipping on the heels of McDonald's about a year ago, trying to look like a good actor, like a company that's taking this issue and responsibly. But unfortunately, what they're doing is they're cutting this one drug, tylosin, that I mentioned, by 20% in a portion of their supply chain. And when you add up all the numbers, what they're currently doing amounts to about a 6% reduction, which is really not anything to be bragging about. And yet Wendy's has been very publicly greenwashing their purported progress on this issue. So Antibiotics Off the Menu, our coalition, has been campaigning, calling on Wendy's to do better, to set a comprehensive time-bound policy that sets concrete reduction targets for all medically important drugs, not just this one, in their beef supply chains. We'd love for them to do pork as well. And when I spoke at their shareholder meeting in June in Dublin, Ohio, actually where this picture is taken, they also said that they would publicize reduction targets next year, which we're all very curious to see. But the bottom line with all of these three examples that I just shared with you, there's sort of two bottom lines really. One is there's no consistency between how these companies are handling commitments, and they're all trying to do something because they know that that is what the public expects and what is the right thing to do, but they don't. Right now, it's unclear whether any of their pledges are going to be substantive enough to really move the needle in the beef sector. And also that the investor engagement that has complemented the consumer-facing advocacy led by the Antibiotics Off the Menu Coalition has been critical in moving the issue forward, whether with McDonald's, with Yum Brands, with Wendy's, et cetera. That complement is really powerful. So thank you for doing that great work and for giving us a chance to talk about chain reaction. I think I'll stop here and see if there are any questions before I turn it over to David and to Laura.
Great, thanks so much, Lena. And we do have a few questions that have come in. So one is regarding sort of public policy. Under our current administration, do you find that current discussions on public policy, is it helping or hurting on this threat? Any public policy out there that investors should be reacting to?
Yeah, well, you know what, I'd love to punt the federal policy question to David, but I will say that there's an interesting intersection and opportunity really happening through an ordinance, a local policy that passed in San Francisco a couple of years ago that kind of bridges the public policy side of the equation and the marketplace. A few years ago, San Francisco said that they would survey all of the top grocery chains in the city and county, which includes, Costco, Trader Joe's, Safeway, Kroger, et cetera. I mean, the only really major chain it doesn't include, I think, is Walmart, and ask these retailers to provide a lot of information about the similar idea, the policies and practices, but in a lot more detail, frankly, than chain reaction does, to the city and county, who would then coalesce this information into a report and release it to the public. And their report has not, the first report has not been released yet. I expect it to come out in the beginning of the year, but we know through that effort that the industry is stalling. They're digging in their heels. They do not want to release this information. There's this sort of stranglehold on data and a lack of transparency and a push toward continued secrecy that's really troubling. And this is an area where I wonder if there's a way for the investor community to engage, because they're mostly publicly held companies that are being asked to participate in this public policy initiative.
Mm-hmm.
And David, do you want to weigh in, or Laura, on what's going on federally?
This is David. Why don't we take other questions, and I'll just kind of loop a response back into my part of my intro when I move to my slides.
Terrific. Thanks, David. So a couple of other questions. Do you have any insights, such as why a company like Tyson was such an early leader within its poultry, but is silent on beef? From your perspective, is there anything particularly challenging about beef versus poultry in terms of production practices, vet-farmer relationships, et cetera?
I can't begin to sort of guess what's happening at Tyson specifically. But I would encourage those questions, to be asked to anyone talking to the company. I think it's important for them to hear from us. Beef is, by virtue of the animals being larger and longer lived, it is right now more difficult for the industry to make change. I mean, really, the use of antibiotics is fundamental to the way that the feedlot system operates. And, while that may be true, that also was true for chicken. a number of years ago. But what happened in chicken is that a couple of leading companies, and actually it was Tyson and Purdue, I think at the beginning, that really decided to take this on and to figure out alternatives and to invest in solving the problem. And for reasons that I cannot discern right now, the beef industry, it's just much farther behind in terms of doing the same thing. So I know that there is activity and sort of there's a coming together of sorts around this tylosin question and whether they can figure out how to use less tylosin, but there does not seem to be any emphasis on comprehensive rethinking of the feedlot model, including feeding animals, you know, a lot more of the appropriate diets, for example, because the antibiotics use comes into play in large part because of a few different factors related to feedlot operations, including the grain-based diet that causes liver abscesses. So there's a lot more information actually in the chain reaction report itself. Just there's a couple pages in there that goes into what's going on specifically around beef production and what the solutions are. Mm-hmm. But why, I can't speak to why they don't seem to be, the industry doesn't seem to be taking this more seriously.
Mm-hmm. I think you're absolutely right. It's a right question for investor engagement with that company, with Tyson in particular. And related question, you sort of answered this with the previous question, but Kenneth asked, do you feel that chicken producers have embraced the initiative simply because the lifespan of chicken is so short and therefore antibiotic drugs aren't really that necessary?
Yeah, I mean, that's a part of it. So, right, it's that difference between an animal that lives for 6 or 7 weeks versus one whose lifespan is anywhere from 18 months to 2 years. So that is a factor in figuring out how to reduce or change the way antibiotics are raised. But at the same time, we know that there are many countries in the world that are raising cows without relying on routine antibiotic use the way we do in the United States. So it's really a model that's not focused on animal husbandry. It's not focused on, you know, this public health crisis that we're in the midst of. And it's not focused on thinking about the best management practices. It seems to be primarily focused on efficiency at the expense of everything else. And so when you prioritize that, that you end up with the system that we have. So yeah, chickens are, but just to say, antibiotics were used routinely and still are, you know, in a sector of the industry, even with chicken. So it's not to say that they weren't, you know, those drugs were an integral part of their operations too, until they decided to do something about it. So I think it's that it's that kind of inflection point that I don't think we've hit yet with beef.
Great, thanks, Lena. Thanks so much for your presentation. And if there are other questions that come up, type them in the chat box and we'll get them towards the end. So David, let's turn to you on the standards.
Yeah, thank you. This is David Wallinga. I'm a physician and a senior health officer at NRDC. So Lena and I work very closely on the same team. I'm actually working out of St. Paul where I live and have been working on these issues for quite a while, almost 20 years. So there's a lot to talk about, and we're going to hit some of it, but feel free to follow up later on if you want to dig deeper. So what does responsible antibiotic use look like? One of the challenges in this work is through chain reaction and the advocacy of groups like ours, we've really built demand for something different than how antibiotics are being used, but we needed to be able to point to really some more specific criteria about what we think would be a more responsible use of antibiotics. And in part, to try and answer the previous question about federal policy, that's because the regulatory agencies, which is really FDA when it comes to livestock antibiotics, does not do a good job of laying out what responsible antibiotic use looks like. In fact, quite the contrary, FDA has sort of refused to define some basic terms like antibiotics used for disease prevention. What does that mean exactly? FDA doesn't really define it. FDA, after a lot of years of prodding, did finally do something significant a few years ago at the beginning of 2017, and that is they got rid of antibiotic use for growth promotion. So in other words, feeding antibiotics to groups of animals specifically to make them grow faster. The problem, though, is that a lot of use, a lot of the addition of antibiotics to groups of animals, herds of animals in their feed continues, but we call it disease prevention rather than growth promotion, even though the dosage at which it's added to feed can be the same as was used for growth promotion, even though it's can be added to the feed for much of the life of the animal. So again, this problem that FDA hasn't defined what they mean by disease prevention is problematic. So next slide, please. So into that gap, that disconnect, there's been an effort on the part of NRDC and Laura, who you're going to hear from later, and others, to define what we mean by responsible use. So the label that you see on the left is actually a product label, and the URL is at the bottom of the label there. It's Certified Responsible Antibiotic Use.org. And this is a label and a standard that was developed in 2014 and has been used thus far really for poultry production and by and large for chicken. The goal behind the label, if you dig into the details, it was specifically to limit antibiotic use and get rid of these routine uses such as for disease prevention, so that the remaining use of antibiotics is really in a science-based way for flocks or animals where there's a real diagnosis of disease. So you're treating something real rather than just the fear that the animals might be getting sick down the road. And I'm going to dig in a little bit more into this down in the following slides, but by and large, this isn't a label that you see in the grocery store, although it could be down the road. It's mostly been a label applied to poultry items that are sold for institutional purchasers, like schools and hospitals and other entities. What's really significant is that it's a label that describes a program that is independently verified. So when Lena was talking about the McDonald's commitment on beef, one concern is that there's no third-party verification of that claim. This, in contrast, is a label and a program that's third-party audited by the USDA. So they go out and they inspect the facilities, the operations, and make sure that the operations comply with the criteria under the program. And so for the last couple of years, this program around chicken has been managed by George Washington University and Laura and her team at ARAC. Next slide, please. So there's been a lot of companies that have adopted this CRAU, we call it CRAU, this CRAU standard for their poultry supply chains, including some of the biggest names in that sector. Next slide, please. But there hasn't been until recently, hasn't been an equivalent program for beef and pork. And why is that important? Well, we heard from Lena already in some detail that beef and pork sectors alone account for more than 80%, 81% of all the sales of these human class antibiotics sold for food animal use. So chicken's very small percentage, 4%, turkey about 11%, beef and pork 81%. Until last week, we didn't know how that was changing over time. What we now know is that beef and pork use as a percentage of all the animal sales isn't going down, it's going up, or at least since 2017. So just in the last year, or relative to 2017, sales for swine use went up over 17%. Sales for cattle use went up 8%. At the same time, we heard a lot about the improvements in the chicken sector, and those sales actually dropped 17%. So really the food animal production is fragmenting with continued improvements on the poultry side and chicken especially, and comparatively worse picture, and especially in beef and pork because of the volume of use there. Next slide, please. So it was really important that we develop something on paper that describes what responsible use would look like for those industries, in the hopes that there are producers out there who want to improve their score in chain reaction, who want to be able to claim on a label that they are using antibiotics responsibly. So over the last couple of years, NRDC, along with our allies like ARAC and others, have put together these new standards, which George Washington has agreed to manage these standards moving forward. So they'll become part of their CRAU program, along with that very successful chicken standard. And next slide, please. And these are going to address some of the issues, some of the shortcomings of the federal policy that we heard about. So some aspects of these, and I hope maybe with questions we can delve into some details, but just an overview. They start off, for example, with a requirement that the producer has antibiotic use that's part of an overall program for antibiotic stewardship. And it's a program that's under the oversight of a veterinarian. They require that if animals are sick, that they get treated. And they also are framed very much in the sense that of operations that are interested in improving conditions and improving the health of the animals in those facilities so as to reduce the need for antibiotics. And this is actually in keeping with a lot of very successful programs across the European Union. But it's very different from the approach that the FDA has taken. The FDA, when they talk about antibiotic use, talks about using antibiotics judiciously so as to reduce disease. And the Europeans talk about reducing disease so as to prevent the use of antibiotics. So very much in the latter case, the idea that, you know, there's a crisis in antibiotic resistance and we need to make antibiotic use reduction kind of a cornerstone of our overall program for raising animals for food. Some other aspects of these new standards, they're multi-tier, so they have an entry level and then some higher tier levels. And the idea for that is to kind of meet the producers where they're at. So if there's a particular producer that wants to start improving their production model with respect to antibiotic use, they can start at the entry tier. Maybe there's a producer that's already got some other certifications and they want to gain a certification that's specific to antibiotic use. They might qualify at one of the higher tiers, which is a level 2 or level 3. And then another aspect of these new standards is that they require data collection. And there's two two thoughts for that. One is that when the auditor comes in, they're going to be auditing according to the data that the producer holds on to make sure that they're doing what the standard requires them to do. The other idea, though, is that to reach higher tiers, higher levels of production under the standard, there needs to be some demonstration of continuous improvement or improvement to use fewer antibiotics at those higher tiers. Next slide, please. So next slide, please. Okay. So for whatever reason, oh, there we go. So that's where things stand right now, and we made those new standards public in mid-October, and Laura's going to talk to you now about how companies, for example, that are not happy with their scores under chain reaction or want to show their customers that they're taking responsible antibiotic use seriously, what they can do next. Okay, Laura.
Hi, good morning, everybody. Thank you, David. So it's a pretty simple process for companies that might want to join CRAU, especially if it is in the poultry sector. That program, as David pointed out, has been up and running since 2014. And our auditors at USDA, I like to quote them because what they call the program is it's quote unquote a well-oiled machine. We really don't have any issues. We rarely ever see farms being removed from the program anymore. Farmers have figured out what they need to do, the changes they need to implement on the ground. But we'd love to have more. We don't have all of the chicken industry, but we offer a solution. But we're really excited, and so is the USDA, about our new focus on beef and pork. And a huge shout out to David and his team for developing the standards and then allowing us to add them to our program. And so really what we need at this point is we're actively seeking a company or two to pick up one or both of the standards and then work with us and the auditors at USDA to put the standards, to take them from being something that's on a piece of paper to something that's implemented onto a farm so that it's a real program. And what we found with the chicken industry is, we came up with a standard and we sort of had this philosophy of, well, if we build it, they'll come, right? But we didn't know, but lo and behold, they did, and they've stayed with us. And so that's really what we need now is, I'll just use Chipotle since they do everything right. They would need to be a part of the program, but we would need a Chipotle or a Yum Brands to come and then work with us to do, excuse me, to get the program audited, and then others can follow suit through USDA by developing either a QSA program, which is stands for Quality System Assessment, or a Process Verified program. So it's really that simple. So if people on this call have any ideas, or if you have food service suppliers that you think could be interested, please send them our way. We'd love to work with them and make this as painless as possible, and then help them do the right thing by helping to protect public health. So I think I can stop there and ask if there are any questions related to anything David and I just covered. And if not, I can turn it back over to Lena.
Great, thanks, Laura and David. A few questions. Any industry pushback on the standards?
David, I don't know if you want to answer. I mean, there certainly was no industry pushback on our poultry standard. We started with chicken, and then we included turkey into that. There were some little bit of rough spots with some of the companies because you can't just stop using antibiotics. You have to make some changes on the farm, and that's happened. So, and like I said, right now those standards are pieces of paper, and we're very willing to work with companies to make sure that what we've come up with is actually implementable and auditable on the ground.
I would add that there hasn't been pushback directly to us, but if you're familiar at all with the Deadly Germs series that the New York Times has been reporting on over the course of the year, there's been some really telling responses by the industry to that reporting. So for example, just a few weeks ago, Andrew Jacobs wrote about sort of a lack of transparency in the response of the pork sector in particular. And as Lena had suggested, there's been a little bit of a circling of the wagons, not only in the beef industry, but in the pork industry as well. And just really not acknowledging how important it is to all of us to reduce antibiotic use overall, whether it's in medicine, but also in livestock production, so that all of us are going to benefit from more effective antibiotics down the road. So, I think that's unfortunate, but it also means, I guess, the silver lining in that cloud is that if there is a company that chooses to produce to like a CRAU label, they could find themselves in much the same position that Purdue or Tyson or one of the other early adopters of the chicken CRAU standard did, which is that, they saw a great deal of demand for their product. And so arguably there's a real market opportunity there for an early leader.
Are there current requests out to certain companies right now to use the standard?
We actually, in the course of developing them, talked to quite a few companies. They were given ample opportunity for feedback and over the course of it. So they're aware that we've been working on these and kind of, I guess, waiting for that, for the next step.
Yeah, I feel like this is a ripe opportunity, especially for investors, to pick this up and put it in front of companies. Companies like McDonald's, for example, who our investors have worked with, along with allied organizations like all of you on the line, to get them to make a commitment on beef. So just as they're trying to figure out the implementation side of things, it seems that there's a ripe opportunity there, and especially as they've been reaching out to investors to continue this dialogue. I guess another one that comes to mind is Wendy's, for all the reasons that Lena pointed out. And we have conversations on food service providers like Aramark, for example. So I feel like there are a few ripe opportunities to raise this and put it in front of companies.
Say, can I pipe in with one more point?
Sure.
One thing that's interesting that's going to happen, as I said, and as Lena said, what the responsible use idea as laid out in these new standards revolves around is basically not using these medically important antibiotics in a routine way, such as for disease prevention. So just last year, about a year ago, the European Parliament actually passed legislation that's going to mean the end of routine preventive use of antibiotics in the EU by 2022. So one kind of interesting thing is, what are these global companies with supply chains in multiple countries going to do? And right now, it seems like they're going to have one set of criteria for antibiotic use for the EU market and a different set of criteria for the US market. And that's, again, I think that's an opportunity to maybe harmonize to the in the upward or the more responsible antibiotic direction.
Terrific. I mean, that's a great talking point, David. So if there is sort of a FAQ or talking point document that can be shared with investors as we prepare for these engagements, that would be excellent.
So parting thought here, I'm going to kick it back to Elena.
Thanks, David. I'm checking to make sure you all can hear me still.
Yeah.
Okay, great. Well, I came across this quote recently from Dame Sally Davies, who's the Chief Medical Officer of England and somebody who has been a real global champion on action when it comes to antimicrobial and antibiotic resistance. And, you know, we often, I mean, I think in all of our worlds, you know, and now climate change has become this really dominant topic of conversation and discourse, and you know, everyone sort of is coming around to understanding that this is critical and needs our collective attention, which is great. But this quote for me is powerful because it's just a reminder that we actually have two parallel global health threats that are emerging and unfolding around us, kind of invisibly, but still very potently. And one of those is antimicrobial resistance, and the other is climate change. So I had just never seen anyone connecting the dots like that. And it's worth keeping in mind, but it's also something that I'll just say keeps me up at night because we have a lot of work to do. And I really appreciate everything that the investor community is doing on this issue. And I'm sure you guys are working on climate change as well, and look forward to our continued collaboration. So I think we can leave it here. The last slide in the deck is just asking if folks have questions, which I think we've covered pretty well. But if there are follow-up inquiries about our marketplace advocacy, our engagement with these companies, the CRAU standard, or anything else, David, Laura, and I are at your disposal anytime. And Nadira can certainly pass on all of our contact info.
Great, thank you so much. Many thanks and appreciation for Lena, David, and Laura for joining us for this conversation today. And we will continue to be talking with each other as we meet with companies. Final comment here with our investors on the line: there are opportunities to co-file proposals on this subject. So if you're interested in co-filing opportunities, please be in touch with me at narinenarine@iccr.org. Thanks, everyone.
Thank you.
And happy holidays. Bye-bye.
Thank you.
Bye-bye.
Bye. Thank you.